How are you doing, Musa?
I'm all right, Jonathan. How are you?
I'm fine. How you went to a wedding?
Oh
Is that
yeah,
right?
yeah. Well,
They
it
they
was
wouldn't let you in.
it was a very grand wedding, but it was for one of my wife's friends' sisters, and because it's so grand and done in such a grand place, I think it's some castle or something. They were limited for numbers, so I ended up sitting outside in a hotel, babysitting the kids. But it's okay. I'm not bitter. I'm not bitter.
Little bit. Did you
Oh,
get?
maybe just a
Did
little
they
bit.
bring you some food, or did you have to get a pizza in?
Well, they offered to send the food,
Hmm.
but the wife refused. She didn't take it.
That's very funny.
So how are you? How are you doing, Jonathan? How have you
I-
been?
I'm I'm all right. I'm sort of keeping busy and swimming and
Oh yeah,
dealing with all the stuff on my desk and trying to get things done. Nah, as usual, as usual. And
you turned 60 recently, isn't it?
I turned 60. Yeah, yeah, which was which is fine. I think I should. I was always a bit older than I am, and I'm finally catching up myself. I think actually I used to think I was 80. I had sort of the character of an 80-year-old, but I think I'm actually this is who I am. I'm about 60, so I think that's roughly it. Yeah.
Sure.
How
Okay.
how old are you now, Musa?
I am 42, but I feel, oh my goodness, I feel like I'm 72.
Really?
Yeah, I feel over the hill a bit actually.
Swimming changes it.
Yeah, I think so.
Big
Yeah,
fan.
well, one of
Big
the
fan.
things about being a psychiatrist is it's basically it's a sit down job, and it's awful. I sit
Yeah,
down,
really.
I listen for hours to people's stories, which is all right. It's intellectually interesting, um, but yeah, I, it really takes it out of you. I think the physical side. I need a more active job. When I was a young doctor running around the hospitals, you could feel it at the end of the day. Your feet would hurt you, but yeah.
But not anymore. You can't do a walk and talk with the patients. You can't sort of.
Well, I was thinking, and I mean, seriously, I was thinking of. So some people, I always used to find this a bit strange. A bit weird. You log on to meeting with them, and they're standing up, right? I always found that a bit intimidating. Maybe I'll do that though.
Of course, because when you're meeting them online, do you have any
Yeah.
rules like you should be sat down or something like that?
The thing is, I think people want security, stability, certainty when they see the doctor, right? Yeah. I even explain to all my patients why I don't wear a suit, and I make a bit of a joke about it. So I don't have a suit and a tie and a monocle, but you will get a professional opinion from me today. That kind of thing, right? Because people want to see a doctor they can trust, isn't it? Yeah.
Is that why you
So
don't wear
yeah,
a suit?
I don't wear a suit because I can't be bothered to wear a suit
Do you
because
have a
I
Do you
don't.
have a suit?
I probably do, but it's probably about 4 sizes too small, which is probably a good reason why I wasn't
Maybe
invited to
that's
the
what.
wedding.
Yeah, that's what I was thinking.
Sure. But Jonathan, you had a recent interaction with a psychiatrist, right?
I haven't, no, but I'm thinking of heading down
Oh,
that realm. I mean, I've been in psychotherapy for many years, and
sure.
you know, I do other things to look at those sides of me. But I'm coming to the conclusion that it's a very sort of I'm not coming to it comfortably that I need to get. I'm possibly thinking of going on ADHD meds, but which requires a diagnosis. Uh, but it's unbearable at times. But I'm not sure. I'm always fighting
Sorry.
it.
What's unbearable?
Well, you see, I haven't had an official diagnosis, so I can't
Hmm.
say I've got ADHD, or I could. I'd just be like everyone who says it. But I have done these tests. I've done the sort of standard tests online. I
Sure.
mean, it's shockingly high. I think I could get 40 points, and I got 38. And I was like, "Ow!" That was So it's not like I'm climbing the walls. I'm not that sort of person. It's all in here. It's not out there. So I'm not actually that productive because
Hmm.
I'm constantly distracted. As a friend of mine said, he said he's a very good friend. He said hanging around like you, it's like being with a Jack Russell in a field full of rabbits. It's just
Oh, really?
starting. Oh yeah. So that's how I am. And yeah, I mean, I've got my school reports here. I mean, they're absolutely.
Oh,
I mean, it's shocking.
did you
It's
mind, Jonathan, if we talk about it a little bit?
yeah. No. I'm doctor. I'm here. Tell me. I mean, because I'm very wary of the whole thing, and I don't like the idea of meds one bit.
Hmm.
I mean, I have an issue with meds, so
Sure.
we
So
can.
I'm going to give you a caveat right now, which is, um, so I'm a general adult psychiatrist. In my training, I did see and diagnose patients with ADHD. I don't do it anymore. Things have changed, I think, in the last 10 years, Um, I think that if I wanted to do it, which, to be frank with you, Jonathan, I think quite a lot about doing because it's rather very lucrative for a psychiatrist. That's just a fact. There's a burgeoning market for this. I would probably want to do a course for a few days again, and get back into the hang of things. So I don't do it. Um, but then again, um, I have some very complicated views about ADHD because I certainly believe that it exists. Certainly, I've diagnosed people with it. Uh, I think that it's been underdiagnosed. I also think there's a massive overdiagnosis problem, and I think there's a generally medicalization problem in society, right? So anything I say today should not be taken as clinical advice, but just the views of a jobbing practitioner with a slightly cynical
But
eye on things.
you sound like you've got a dose of it yourself. You say it's been massively underdiagnosed and it's massively overdiagnosed. So which one is it, or what is it, past and present? That we
Jonathan, can't two things coexist at once?
not
Can't
not
so
not where the opposite lines of the same spectrum,
let
right?
let let, let let's let's leave ADHD. I want to speak about your ADHD, right, or your presumed ADHD, but let's put ADHD to the side and let's think about depression. Is it true, Jonathan, in your day-to-day life and society, getting on in society, that you meet some people who are depressed and they don't know it? Have you ever met those people?
I meet those people. I've been one of those people.
Sure. Okay. Is it true that there are some people who, you go to a dinner party and everything, and they just want to put it in your face how depressed they are and how they had this and how they had that, and you know that they're not depressed and they might be getting some other benefit from that diagnosis of depression rather than the primary depression diagnosis that they have? Do you think that's true as well?
I feel like I'm being set up like a barrister would set someone up. It's very Socratic, but carry on. Yes, I think that's true too.
So there's an underdiagnosis and an overdiagnosis issue
Oh,
with
I see. That's
depression.
your point. That's very well done. Yeah. Okay. Yeah. I go
So
with that.
wouldn't there be the same thing with ADHD? And then I think the final point, which I'll make, and then we might come back to, is that of course the diagnosis doesn't exist in a vacuum, does it? There are strong sociological drivers for diagnosis in every epoch, in every era, in every culture, in every society, in every subculture, that we sometimes have to tease apart. What does a diagnosis mean? What does it mean for this individual at this time? Whether that be a pharmaceutical company, whether that be a labeling effect, whether that be how the individual relates to their family, right? And that's all outside of the clinical interaction that I have with you today. If I was to be your doctor, right? Because we don't consider any of that. We just consider your symptoms, how long you've had them for, and a few other criteria based on the DSM and ICD-10. Nowhere does it say in that. Nowhere does it say in any of those items. What does your family think of this condition? What do you? What are you really getting out of this? You know.
Yeah. Yeah,
Yeah,
I'm with you. Yeah, no, absolutely. And I think there's other things. There's a whole.
but
We live in the age of
sure,
productivity and distraction. We live like it's never been before. And
sure. So with that caveat, I just want to say this is not clinical advice. You can't sue me if I get it wrong,
is
Jonathan.
that is that what,
But
is that what it means?
well, deep down,
I
that's what
wouldn't sue you.
you wouldn't.
No,
Okay.
of course.
So some of the viewers might.
Some of
You're
the viewers
too
might
nice.
sue you. Yeah, yeah. I mean, they can sue you. I don't care, but I'm not going to.
I think I care, Jonathan.
Oh my.
But all right, tell me about your symptoms.
Well, what do you call a symptom?
Um, Experiences. So this is how I talk about it with my patients when they ask me that question. I say experiences that you're having that you'd rather not have.
Oh, okay. But yeah, but I can be a bit pedantic. I mean, there's lots of
Sure.
experiences I have that I'd rather not have. I'd rather not wake up at 2 a.m. and need a pee. But
Mm,
so look, what am I having that I do? So I have huge problems getting things done. I
mm,
procrastinate, but I don't quite procrastinate. I'm constantly busy doing things. I have all these lists. I have lists upon lists. I've got lists of lists. You can't see my desk, but it is. I've tidied it, and it's getting out of hand again. I I set off to do something, and I find myself doing something else, and I can't remember what I set off to do. Uh, and it's constant. So I'll go upstairs, and I'll find myself upstairs, and I think, what am I doing here? And then I think, no, you came up here for a reason, and then I have to really go back downstairs, find out what the reason was, and get back upstairs with the reason. Um, so that's constant. As you might notice when I talk to you, I will go off at a tangent very very easily. So the thing that doesn't bother me, but the difficulty getting things done is, and I had hypnotherapy, which
mm.
actually worked for about 8 weeks, and but I got an awful lot done, and I started doing an awful lot more. But it was like all I'd done in a sense was oil the wheel. It was now spinning really fast and well. But it was driving me. I was focusing very well and being driven. I, here's my thing. If
Yeah.
that's who I am, if that's the character I am, and I'll tell you about another bit in a minute. But if that's who I am, do I want to medicate that out of me? Because that's also who I am. I don't know if I want to medicate myself away. I don't know if I want to medicate myself to become someone else. I don't mind becoming someone else. I don't mind that process, but I don't want to. I don't want to medicate it. And I want to add just one thing before you come in again.
Mm,
I lived in a dream world most of my life. I mean, it's only changed in the last 6 years or so. I was always in a fantasy world in my head, and I notice when I'm emotionally stressed, I go back there. I go back into this space. I don't think it. I don't think it is all just chemical levels or something. It is related to my emotions, and it is related to my sense of self and my self-containment. Uh, that's all, Doc. You're over to you.
can I ask you a question? I'm going to just be blunt.
Yeah,
Yeah.
yeah.
Please don't take offense. Right. Yeah.
I'm
What
getting
does
ready to.
a 60-year-old white Jewish British gentleman who has a PhD, who runs a reasonably successful market research company, um, has got lots of friends, uh, quite social, quite gregarious. What is he going to get out of having a diagnosis of ADHD that hasn't been addressed in the last 60 years?
I mean,
It's not a judgmental question. I'm just going to
no,
say
no,
it's not a judge.
no,
I'm just
no,
curious.
no. So this is one of the, so I'm going to have to do that by a sideways, if you like. So my daughter was diagnosed with autism at the age of about 16,
Sure.
and was it not later? Anyway, 16, 17, I can't remember. And I found the whole process because they interview the parents, and I found the whole interviewing process really triggering. I found it very hard because they were asking questions, and I realized not only did she do certain things, I did certain things, and by the end of it, we're all put back together. My daughter's interview comes together with us, and they see me and they said, "Do you want to sit on a wobbly chair?" And I said, "Oh yeah, can I try the wobbly chair?" And the wobbly chair sort of calmed me down. I thought, "Oh my God," it was all about her. So I just did all that. But I phoned them back 3 months later and I said, Do you think I might be somewhere?" And they before I finished, they said, yes, we do think you are somewhere in there. And I said, "Should I get a diagnosis?" Coming to your point. And they said, "No, at your age, what's the point? You've found your mechanisms to cope. You found your ways. There's nothing much you're going to get out of it." But so the diagnosis itself, and it's pretty clear to me something's going on. The diagnosis itself doesn't help. But the chaos of my life, that I want to deal with because it's chaotic. And you see, the trouble with that is, Musa, I project an idea of what it'd be like if it wasn't. And there's some days where it's not. As I say, I'm not totally convinced it's all just some sort of outside of me. I think it is emotionally linked. There's a certain containment going on. I'd just like to. I wouldn't. It's the whirring engine. It's that. It's that constant. That's what's hard. I think that's going to knock years off me. To be quite honest, I think that's going to be the one that gets me in the end. And I mean, I'm so easily distracted. I think I'm going to stop driving. I just think, what's the point? I'm too easily distracted. Well,
There's on the one hand, that's very sad to hear, Jonathan, because I've known you for many years, many years, and you are quirky. I've never thought about ADHD with you before, but maybe that's just because I'm a very unobservant friend. Maybe it's because I'm a dim psychiatrist. I don't know, right? But that's part of your charm, right? That's why I love being with you, hanging out with you, right? We'll start talking about one thing, then we'll just go down a rabbit hole. Just talk for ages. That's kind of what we're doing here today, right? On this podcast. But it sounds like underneath it all, you're talking about these terms, like chaos. Now, people don't talk about chaos without some kind of pathos, some kind of sadness, some kind of okay, there's another overused concept in psychiatry, but some kind of trauma, you know. Yeah, and I just want to dig about, what have you lost from all this kind of hyperactivity, not being able to focus?
what have I lost? Good question. I've lost a lot. I've lost a lot of money in therapy because I'm trying to deal with it. No, I haven't really lost that. I do see that as one of the best investments I ever made. It's been so good for me. So what have I lost? I've lost. Well, it's not what I've lost. It's what I've lost a sense of. I've got a feeling the question's wrong, even though I like the question, and I it is a good question but I don't have a sense of loss.
Yeah.
Is that too literal? But I don't have a sense of loss about it. I have a sense of lack, or I have a sense of. You see, on a good day, I can sit there. But on a bad day, I get through a loaf of bread in tiny little chunks like that. I wander backwards and forwards, just caught, and I'm just can't deal with anything. And you see, I would think that's just my adult self, but it's just looking at these school reports. It's just, I mean, they had no understanding of it.
Come on, all right, okay. Where did you go to school?
Hemel Hempstead.
Hemel Hempstead, North London.
Which is probably, no, it's not.
Don't-
It's a bit further out, but yeah, it's probably damning enough to say I went to school in Hemel Hempstead. But I went to school there, and I mean, they just say he looks perplexed. As a negative thing, he looks perplexed, doesn't concentrate, is messy, doesn't do his best, could do better, all this stuff, and it's just again and again and again.
All right.
And
Okay. Let me just, because I'm curious. This is my job, and I don't want to kind of take a psychiatric history from you as my friend, but and you can tell me no. I don't want to talk about this at any point, right?
okay, is this going to
Let,
be a heavy question?
no, let me just get a picture
Just,
of
just
what's
say it.
going on.
Just say it. Just go.
Yeah, let me get a picture of what's going on. Right, what did mum and dad do?
Professionally or
Mm.
emotionally?
Professionally, yeah.
Professionally. My dad was a medical statistician,
Oh
and
yeah.
my mum ran training courses in geriatrics.
Okay, sure. And were they well-to-do, comfortable? Do you think
Yeah, they were middle class. But like I say,
middle
you see,
class?
we were very middle class. I always said I always thought I was middle class until I went to Sussex University and I found people far more middle class than me. Well, they weren't more middle class; they did it so much better. And I
Okay,
just thought, God, I've lived all my life thinking I was
sure,
middle
sure.
class, but these people, it was
Okay.
like playing with Djokovic at tennis. They were just so much better at being middle class.
Okay, sure. And so you've also told me that you're Jewish by ethnicity, but it wasn't part. It wasn't part. The faith wasn't part of your growing up, but you weren't involved in the local conversations. You met people and such like um,
Met
who
what
had
people?
what
Met
who
which people?
who had the kind of trauma history from the Holocaust and stuff like this, right?
I don't think. I think Jews were just a bit. Oh, to put it mildly, they were, you know, pretty fucked up by it. Oh, sorry, I shouldn't say that. Yeah, I mean, the legacy of it was there. I mean,
That was part.
the anxiety was there. I
That
mean,
was part of your community, was it, Jonathan? I
well, I
mean,
wasn't part of. No, this is
mm,
the other thing. So there's the
yeah,
Christian family down the road who converted.
okay,
My family constantly told me they converted, and they said a lot of Jews have converted. And there were my parents who had met in a Jewish youth club, but didn't follow the thing, and we didn't mix really with the Jewish communities. I didn't do any of that. But meanwhile, there's a nice dose of racism going around because it's 70s and 80s.
mm, mm. Okay. So let's just move this forward. So I want to know
Yeah.
what kind of school you went to.
I went to comprehensive.
Comprehensive, right? Okay. And yeah, what kind of things are they writing in the school reports then?
Oh, Lisa. I mean, wow. What is he here? He struggled to concentrate. Hang on, there's some really damning ones. Let's see if I can find those. You see, I won't be able to find it now. It should be very. Oh, here we go. Here we go. This is this is. Where's it? I'm afraid. This is. I'm 15. This is from the year head or whatever. I'm afraid I do not like his attitude to school or to authority in general, and other staff I have asked think the same way. He seems to think that he can decide whether he does homework set or not, and some occasions when work is done, it is either very untidy or late. He will need to shake his ideas up if he is to achieve the results of which he is capable. Uh, I mean,
Is that
I,
typical, Jonathan, of those reports?
That's very typical of those reports. There's another one. Goodness knows where it is here. I had to
Yeah.
pull it out to discuss it, but it just says it's. I mean, having said that, I mean you can barely read these things. They're pretty messy themselves. I mean, take a look at that. They're very messy. I mean, there's a slight hypocrisy going on, if you ask me. But who am I to tell them that? Yeah, it's
You
constant.
still
And I was
you
always
still
told off for daydreaming.
you still feel a bit wounded by that.
Uh, I just hated school a lot, and it's just given me more
But
reasons to hate it.
hmm. But that makes it sound to me which is not the Jonathan I know, but you were like some uncouth ruffian at school, right?
No, nerdy more than ruffian. But yes, it doesn't fit in. And of course, what teachers like is someone who fits in. That, and I think that's the same in a lot of places. We do like people to fit in, especially if we're running something or we're teaching something. The outlier is, except at art college. I always imagine, but maybe it
Yeah,
has its own dynamics. In the creative industries, maybe somebody who doesn't fit in fits in. I don't know.
yours.
Did you fit
And
in?
no, but I was Pakistani in a very posh. Uh, Although I loved school actually until we had our problems. But yeah, I yeah, there were two Pakistani kids in the whole 800 school of school over 800. There were me and my twin brother. I was speaking to my wife about this today actually on the journey back from the wedding. Um, I didn't even know. I didn't even have the language at that time to tell. I wasn't happy. Um, my brother ran away from home twice. Once was under social services. Um, it was difficult. We didn't even have the language to explain what was happening, and it wasn't ever accepted. But I kind of, I worked that out over time. Yeah, but I'm just thinking about your story. Um, that sounds terrible. Honestly, Jonathan, that sounds terrible. Especially if we take the if we take the thesis which is going to be taken now. I can tell you this, Jonathan. You turn up with that history for an ADHD assessment, and I'm not doing the assessment. You're going to get the diagnosis, right? Whether you actually have it or not is a different question. Um, you're going to get the diagnosis, right? More likely than not, and then that casts the whole the whole of your life in a slightly different light, as in he was a kid with ADHD who was, who had some neurodevelopmental challenges, which was not his fault. It was his brain just wiring slightly differently. That the environment couldn't work out around him is a very old age kind of um, standardized way of teaching, and that just left him a bit worse for wear. And that probably has. Then this is the where it gets tricky, Jonathan. Is then we start saying, well, that has ramifications for his life and the whole way that he's lived his life and how he's been accepted and his potentials and his challenges and all of these kind of things. And there's been some self-inflicted trauma in all of that, which might be the case, Jonathan. I don't know. I have no idea, right? And then well, you tell me you've been in therapy, and then the parallels could be drawn to that. I'm not, of course, speculating about your whole life, but I'm just saying how, like a twist in the kaleidoscope, gives a whole different picture of
But
your life, isn't it?
I think if I knew what I knew now, I would have taken some very different decisions. I would never have done the PhD. It's too much information, too much stuff. Or I would have done one around this subject, so I could have worked with it. Uh, I wouldn't have done a whole load of things. But I think, in there you said something. The thing that's bugging me most is there was nothing you could do about it. But is there anything we can do about it? If I'd been a ruffian, was there anything I could have done about my behaviour? Whatever, ruffian sounds like they're from the medieval periods. But if I'd been out of control and a bit aggressive, I wouldn't have been able to, which I wasn't. But I
Mm.
would, I wouldn't have been able to control that behaviour either. But we can judge that. We go, oh, that's wrong. They're just as stuck. And if I'd been one of those sort of rather snooty kids, I would have been. Well, maybe I was. I don't know, but. It's just stuck. We're all stuck. We're all stuck with these various ways of being. And then society comes along and judges, well, that one's not your fault. That one is your fault. Is that right?
Well, one of the other philosophical issues here, Jonathan, is that in 50 years' time, what are we going to call this ADHD? We're going to call it, I can tell you, I almost said, we're going to call it something completely different. The diagnoses are going to be so completely different. The criteria are going to be completely different. And we're going to be turning around and say, oh, well, we never knew this about personality. And,
Yeah.
and all of our, nurturing and caring school approaches that we're taking now, and we're thinking these are all very modern, will be poo-pooed and rubbished, and and that will lead to a whole tumult, within individuals throughout society, like is happening with ADHD now, right? Um, and that perhaps doesn't take account for the fluidity of society, right? Your teachers, when they wrote that, they probably had some benign sense of themselves as trying to get you to lift yourself up by your jock straps and to
Yeah.
be the best you could be, right? And this was just a bit of hard love. Yeah.
It sounds like
um
it's taking a line from it. He needs to pull himself up,
yeah.
but he doesn't know how. And also, I'm being bullied badly. I mean,
Yeah.
I don't go down well. And and of course
Well,
the National Front are very strong. So being a
hang
Jew
about.
in the school is difficult as well. But now we're looking at
Jonathan.
school. Yeah, go on.
Okay. Firstly, maybe I'm just dim or something, right? So I knew you for years and years before I knew you were Jewish. It just so happened to come up in conversation. I think about Corbyn and the Labour Party we were discussing at the time. Um, was it was it written all over your face that you're Jewish, or what? I mean,
I don't know. I don't know what it was about. But I mean, I don't know when when I'm exposed as a Jew, or when I confessed I was a Jew, or when I just let it slip, or when I didn't see there was a problem with it because it didn't strike me as problematic. And then you discover it is problematic for people. I don't know, and of course I was an atheist, so it was probably just me, just dealing with my own things at the time, going, "How am I Jewish? How am I an atheist? What's all this mean?" And I was there were some very strong Bible bashing teachers there who didn't
okay.
like the fact that I was an atheist. They really didn't like that at all, which is curious in itself. So I mean, but I mean, yes, so school as an experience was far from
What what
positive.
what
I
what
think I walked in fairly intelligent, and I walked out a lot more stupid. I think it
what
actually
was
regressed me.
what was the bullying about? Was it about the Jewishness? Was it about the neurodivergence or being different? What was that about?
I mean, if we look at it, the Jewishness was definitely part of it. It was
Yeah.
gas him, gas him. There was a lot of
Oh,
spitting because punk was about, so there was a lot of spitting on me. But I also wasn't quite, I didn't quite fit in those senses. But also, I mean, maybe I'll be careful with my words. Those kids who certain people become targets of bullies because they have exhibit certain characteristics, and I guess that was also going on. I didn't stand up for myself particularly well. Still find that
mm,
hard. So we got those issues. So I think there's multiple factors going on, and of course the political climate. You had the National Front were very strong, and they were mobilising, and I wasn't in community. It wasn't like I was in Jewish community. We're going, hey, there's more than one of us. Although my sisters weren't bullied, they weren't.
mm,
So it's to do with it's more led. We'd have to go and talk to the people doing it, and that'd be a very interesting conversation. I don't know what they're doing now with their lives, but yeah, well, it'd be not, I mean, we don't see that, do we? We don't see conversations between people who bullied as children, and they bullied, and we don't see the adult conversation taking place. Do they still have that sort of mentality or
mm.
not? I'd be quite interested.
I have to hold myself back here because I have to remind myself that you're my friend and you're not my patient, and so I'm
Yeah,
not going
so
to take the
sorry.
conversation. No, in
Sorry. Yeah,
certain
yeah, yeah,
direction.
yeah.
Yeah, yeah. But it's a fascinating story, and I'm just wondering Okay, so if we now get the diagnosis of ADHD, you know, which I, as I've said, I strongly suspect you will get. That's not my
Mhm.
professional opinion.
Mhm.
That's my opinion of the systems and services we have today.
Okay.
Um, how will that, um, yeah, will that reinterpret your life for you? Because there was a lot going on there. There's a lot to unpick and unpack. And after that, of course, the subsequent 40 years that followed that, there will, which we haven't discussed really, right? There'll be a lot to unpack in that as well. Will it reinterpret your life for you?
No. I mean, this is because it's not like it's suddenly new. It's not like suddenly I've I'm having this conversation. I'm going, oh, what's that? ADHD? What is that?
Mm,
Autism? What's that? I've never heard of this before. No, I mean, I mean, certainly since my daughter didn't just get a diagnosis. She got very interested in the whole subject. I was going, look, Dad, you're doing this again, and you're doing this again. And she made me. She held the mirror up a bit, and I was going, oh, she's a bit right there. Um, so. Uh, in that sense, I've already had those conversations with myself. I suppose what fascinates me is this magical medication thing, which I don't like the idea of because it's a stimulant. And I mean, here's a here's a slightly funny story. I
mm,
used to I used to I used to share a house with people who were selling amphetamine sulfate, speed. But
sure.
I was sharing them. I never used to like it, because it was going for free, and they were taking it every night, as you would. Um, and I take it, and I gasp, and I go, "What's the point of this? What is the point of this drug? It does nothing. It does nothing. All you do is you stay awake. It has no effect on you." Uh, and I suspect what was going on. It was just doing nothing. It was just straightening me out, and I was incredibly bored by it. It was a totally useless drug, in my opinion. It had no drug-like effects, and
Hmm.
because I think that's what the medication is, isn't it? It's a stimulant, much the
Yeah.
same, and it just straightens you out, which, of course, as a party device, is totally pointless if that's what it's going to do. So it never sat with me well. Um, so I don't know if that helps in any way. What do the medications do, and why do they do it, and what's all that
Well,
about?
look,
What's the bit about changing who we are with these medications? Because that's the business you're involved in.
sure. I mean, so the medications they help. Firstly, right? Um, I speak to many patients every day who tell me that it has transformed their lives for them. Not everybody finds it so transformative. Yeah. Um, they need monitoring. There can be side effects. Uh, the problem with the systems that we have in the UK at the moment is that we don't have uh, enough services for titration of these medications. So if I give you an example of depression or anxiety, if I start somebody on medication for depression or anxiety, I know when to up the dose, when to decrease the dose. It's pretty simple for me to see people, every six
Titration's the
weeks.
upping. Titration
Yeah,
is
yeah,
upping
yeah,
and
yeah.
downing
Getting the dose right,
doses.
when to switch to different medication. And it's very simple for me to see somebody, or for a patient to see either me or their general practitioner who will be well versed in many of these medications, and to kind of get the dose right and to work out. There's a whole system. It's not just the medication itself; it's making sure that the medication is prescribed appropriately. The problem with ADHD is that although the medication is there are different types of medication. There's four or five, um, and there's different doses and dose regimens we can go with. The services for titration or ongoing monitoring are not really there. So essentially, you get prescribed the medication, titrated onto it, and then hand it over to your GP, who just doesn't have a clue. Do you know what I mean? I mean, they have some, and this is happening more and more, right? And and so sometimes what I see is that, because I don't deal with ADHD primarily, right? But I see some of the kind of side effects. Sometimes when it goes wrong, there are some cases. I don't want to overplay this, but of dysphoria that I see. By dysphoria, I mean a kind of emptiness, a low mood, when clearly that's not what the medication is aiming to do, right? And people often get lost off the system and all of these kind of things. So the problem that we have in the UK right now is a resource problem. The other thing that I am slightly skeptical about in myself, I don't see these medications as changing personality. I see them as short-term medications which help with some of the symptoms that people with ADHD suffer from. And indeed, if we took many of these medications, if I took many of them as someone who's, I presume I'm neurotypical, I would see differences in, so for example, some of these medications have been abused for, medical student examinations. There's a history, old history, right? So the thing
Yeah.
is that the medication kind of working doesn't necessarily prove that you have ADHD. It just shows that the medications are good for focus and attention. Yeah. And so, yeah. The other thing I always have skepticism about, although I have to temper that skepticism somewhat, is what do we actually know about what these medications are doing to us, our brains, our bodies long term? I have also been an academic. I've also seen the clinical data, not particularly about ADHD, but I also know the limitations of the data which is reported. The fact that if something is not measured, then it cannot be reported. The fact that there are strong and sometimes perverse incentives for certain medications to get results, to be reported in a certain way. It's not all big pharma's fault. Scientists in universities are just as bad. I've seen that as well. Does that make sense? So,
Oh, it makes
um,
sense. I mean, this is
I've
one of the issues for me.
yeah, so
I mean,
basically, you have to play it by ear, right? You have to go in there as an informed consumer, right? Because that's what we've essentially become, consumers of diagnosis and healthcare interventions.
but
And
let's get down. Let's get
yeah,
to this chemical thing,
yeah,
because this is where I have an issue. If I was taking a chemical thing, like or a thing, let's take antibiotics. You take them for 7 to 10 days, and then you
mm,
stop. It's not habitual, but the money is in making habitual drugs. It's not making or
sure,
making a
sure,
large scale drug. A vaccination drug is also another one where the research will pay off because it's such large scale. It's got global populations. But this habitual thing, and as you know, I looked at the cannabis industry for some time, and of course,
yeah, yeah,
one of the one of the many things that disturbed me about it was all promoting habitual use of something which was highly habituating to the point of addiction in the first place. And they were saying, "Oh no, it works better if you take it daily. Everything in the market works better if you take it daily. You name it, it's all about daily use." Um, and you can even see it with sort of companies that run off algorithms,
sure,
post
sure, sure,
daily,
sure.
and you'll get a high rating. It's all about that. So that's really disturbs me. Then you're doing that for how long? And what happens when you stop taking it? Uh, and how long are you meant to be on it? And what's the effect of taking something like that for 10 years? Does it, I lead a simple life in many ways, I eat sensible foods. I have about 2 cups of coffee a day. I don't drink much alcohol, hardly any.
Mm,
I don't smoke. I don't do these things. I, like to swim. I don't really want to take a pill. And, I've been prescribed pills at times, a pill for my stomach. You know what was the best thing for my stomach? Drinking water and exercise. The pill, yeah. Without it, life was hell. But if I stopped taking it and stopped after 3 weeks, it was not hell anymore. There's that aspect. Am I doing a deal with the devil? Am I going to get a dependence in order just to get a few tasks done? Is that the deal? In order to get through the day.
Yeah, Jonathan, these drugs are not seen to be typically addicting or dependence inducing, although of course they are stimulant medications, so they are controlled drugs, right? You can't take them lightly, but the argument is, the conventional psychiatric argument is, if you take them as if they should be taken and as they're prescribed, it's not dangerous. There's no evidence of, for example, increase in psychosis, increase in other substance abuse. Do I sometimes see people, Jonathan, who are drug users and want an ADHD diagnosis so they can abuse legal amphetamines as well? Of course I do. Of course I do. But the doses are relatively modest. It can, for some people, it can work very well with their lifestyles. Some people have, uh, some people find them transformational, right? But whether you find it transformational, Jonathan, and whether it works for you is a question really between you and your doctor, right? And uh, the problem is that conversation between you and your doctor is not an independent conversation. You are not independent of societal influences, nor is your doctor independent of the medical forces which may be pushing and pulling him um, this way or t'other. And what really gets my goat about all of this is, okay, people talk about big bad pharma, and I get that, but I've been an academic myself, we're not influenced just by big bad pharma. We're also influenced by our colleagues who are academics, who are looking to uh, you know who are looking to push and promote their own careers by joining to a cause, right? Which can be just as dangerous.
Okay, and I need to add a proviso here, because that doesn't mean that when someone says, "Oh, there's a doctor in France who says it's all a scam," it doesn't mean that doctor in France is right either. There's a whole host of people with a certain expertise who are pushing an agenda, either for personal
Absolutely.
recognition or for monetary value. And just because someone's going against the system doesn't actually make them any better. They're often just as bad, if not worse. So I mean, there's a danger there that we just believe anyone who says, "Oh, bad big pharma and bad academics." I've got the truth. I've got the truth, Tony, and I'm going
Yeah,
to
yeah,
tell you
yeah.
about it. I mean, they're just as bad. But the thing I kind of, if I could remember what it was, the thing there's two things I don't want to lose. I don't want to lose my ability to see round corners as I think and I talk. I like that. That's why this is why we're doing what we're
Yeah,
doing.
yeah.
I don't want to. I don't want to become neurotypical. I don't want to think in those ways. I mean, no offense. They're
Hmm.
very nice ways of thinking. It's a nice, rational way of thinking, and it's the blocks come out. But oh my God, the world will go a bit dead to me. I see enormous interconnection, and I realize that is part of it. The way I see the way things are connected is because the way I am in the world, um, and I don't want to lose that. And I also wonder whether all this. I don't remember it. I mean, I don't remember it being like that at school, but the report seemed to say so. And I remember in the 80s, I had trouble managing my time, and I was sent on a time management course, but I totally forgot to go on the course. And so there's all these incidents. But I think it's this aspect of modernity. I'm sitting here with two
Hmm.
screens. I've got a phone doing. I've turned off all notifications. It doesn't matter. It's still pulling me in, and it's a sanctuary away from things as well. And I've got a bunch of pens. I've got two cups. I've got this. I've got two pairs. I seem to have two of everything. It's like a Noah's Ark or something. But I've got all that going on, and it's just constant. I'm not bored anymore. I haven't experienced boredom in years because it's just constant. So, am I medicating myself against modernity because I can't deal with it? Which I don't mind if I can't deal with it. I should just go and have a little farmhouse somewhere and grow some vegetables and keep it simple.
So That's a very profound question, isn't it, Jonathan? And it's not just a question about you. In fact, it's a less interesting question about you as an individual as it is compared to us as a society. With all the medications that we're taking, or all the modern paraphernalia of life that we are now sold, right? So one could talk about antidepressants, one could talk about these medications for focus concentration, one could talk about the weight loss jabs that are, being used. Who's sick? Is it us or is it society? That is pushing a particular view and worldview onto us, right? Take weight loss jabs, for example, right? I think you probably wouldn't disagree with me that it's glamorous to be thin, certainly it's glamorous to be skinnier than I am right now, right? And I think you wouldn't disagree with me if I said, well, a big reason for that is probably the movies, television, advertising, all of that, right? So magazine covers. So when we go and we take those weight loss jabs, are we taking it because our blood pressure will come down by so many, uh, by such and such a number, and our central adiposity scores will go down, our inches will go down, we'll be healthier, we'll live longer, and we may have 3, 4, 5 extra years before we get coronary heart disease? Or are we taking it because we want to look like the man or the woman in the pictures?
I think there's another reason going on there, which
Yeah, yeah.
maybe is mentioned less. If you walk around the supermarket, with, and it's a
Mm,
plastic market. Everything's in plastic in the supermarket.
sure.
You shop outside that. You go to the market. You go to a proper market. It's all in paper bags. Go to the supermarket. You come home with a bin full of
Mm.
plastic, which is, I think it's a sign. It should be a warning flag. Something's up here. They're not really acting in
Yeah,
in
yeah.
in society's best interest. And you look at the shelves and the absolute overwhelming, what percentage of a supermarket is carbohydrates? I'd love to know that. It's so carved up. And if you go to Iceland, the freezer place, which is the sort of budget frozen food place, blimey, it's just carbs leaking out everywhere. And our addiction to carbs, not just addiction, it's been pushed at us because the thing with the carb is it's very Moorish. It's very Moorish. If I have a sugary biscuit, I want another one very soon after. And we're back to that thing of habitual use, and we're back to products which have inbuilt addictions in them. They
Sure.
might not
So,
be.
so
And there's one other part of this. It's this thing. We're sat. So we're consuming carbs, sitting down. We'd never, it's not even. Yes, there's the glamorous body thing, but what's on the input side before we have the jab? We've got this image which we were trying to live up to, this lifestyle which is inherently unhealthy and promoted to be such. We're promoted to be on our computers, sitting on our phones, sitting. We walk around the supermarket, we don't have any choice
mm,
but to buy a bunch of carbs. It's just something's going wrong.
it's a kind of
Very
very
wrong.
dystopian worldview, isn't it?
Yeah, and then we can medicate against it all. Well, here's something that'll take you through. I mean, you may as well carry on smoking and just just have something to
Well,
suck out a bit of tar from your
okay.
lungs.
So the issue I think that we all have, Jonathan, is there's many dynamics of society that we don't agree with, that we haven't asked to be put in that position, but we're put in that position. The question is, how do we reclaim some of that back for ourselves? And that's really tough. It's really difficult for me not to go shop at Tesco's. It's really difficult, you know, for me to stand up when I see my patients. Yeah,
That's more
it's
difficult.
it's it's really difficult to not fall into the rut of what societal expectation is for us and to reclaim our own sense of values. And all we can do, we can't change, we can't just walk against the tide all the time. We can just change some small things for us to help us navigate ourselves out of the morass. And for some people, at some times in their life, Jonathan, as I tell my depressed patients all the time, that might involve taking antidepressant medication. And for you, for some period of time in your life, it might actually involve taking some of the ADHD medication. It might not. There's a decision for you to make, right? But yeah, you can't just stand against the whole world. Otherwise, you'll just be defeated by it. But it's worth thinking about what are the social, societal pressures that make us mentally unwell, and why is the burden of mental health conditions overall increasing in this kind of hyper-focused, hyper-connected, apparently very productive age.
You see, I think that's exactly it. And I would go a step further and say, is consumption and the acceleration of a consumptive body, a consumptive persona, is
Jonathan,
that
you're on the left. You're on the left. You keep telling me that you're not left.
No, I'm not on the left.
All right, finish it, go then.
So we become, there's the accelerated consumptive persona,
Sure.
because this is what drives profits and production and in a neoliberal world. And we become consumptive animals, and we move from one consumption to another. And I mean, the amount of stuff I've got in my house, I wouldn't have had this much stuff back. I never knew this. If someone from the 70s walked into houses today, they'd be absolutely gobsmacked. We'd look like bag ladies. We are full of stuff. And everything I do, I mean, I pick up my phone, I'm actually consuming. I'm constantly consuming. And what I'm finding really helps, people say, oh, exercise helps. Well, actually, exercise most of the time isn't consumption. I'm learning to play instruments. It's not really consumption. I'm not watching the things. I'm just trying to do it. These simple things we have done for hundreds of years that are not in the market. Perhaps this is the antidote, that we start to live our non-consumption lives. Perhaps this is the way. And if we can open up a little space between needing to buy this and buy that, or consume this and look at this, and if we can just create a little bit of space, we might get a chance to see who we want to be without someone telling us. Because I look at this medication thing and I think, but by taking that, I'm not going to address the problem. There's a stone in my shoe.
Well, I'm not going to say that I'm anti-medication. I think it has its place, but I think everybody needs to consult with it, think about it deeply, and ideally have an in-depth conversation with the doctor about it, and have a degree of skepticism about medication, about diagnosis, and its place in the world. But that doesn't mean don't follow your doctor's advice.
It's hard, isn't it? It's a balance. It's balancing it rather than just being evangelical about one side or the other.
Yeah.
It's finding a way.
But just to end this conversation, you ever heard of a chap called Karl Marx?
Yeah, I have heard of Karl Marx.
Maybe you want to read the Communist Manifesto.
I don't know.
All right.
It's well
okay.
Okay.
Fantastic conversation, Jonathan.
Thank you very much,
Dr.
Musa. Very good. Thank you.
Bye.